know the red eye is caused by, there are so many causes, but right now we are dealing with the viral form. And in such cases, in such epidemics, the most common virus that we might be dealing with is adenovirus. This is purely clinical diagnosis. It spreads, it's a highly contagious virus. The incubation period when the person gets it, the moment you contact the virus, you will be shedding the virus for up to 2 weeks, actively shedding the virus for up to 2 weeks, sometimes even more. The incubation, from the time you get it to the time you start presenting with the symptoms and the signs, it's usually between 2 to 5 days, but we have started seeing cases as early as 24 hours. So a majority part of it is that from hand hygiene, this is, how can I put it? The virus is actively on surfaces. When someone touches a surface, an unporous surface, that means glass, wood, doors, windows, the virus remains active for almost a month. So and in porous surface like bed sheets, linens, pillows, towels, so that can be active as for even 2 weeks. So hygiene, that is the message we want to tell the public. It's hygiene, hand hygiene. Avoid sharing cosmetics, avoid sharing towels, avoid using people's drugs. That is the message we are passing on. Yes, the patients, how they present is we are seeing swelling, eyelid swelling that starts with one eye, then maybe progresses to the other eye. We are seeing a lot of complaints of redness. They have itchiness. They get a lot of tearing, a lot of excessive discharge in the eye. That is stickiness to the eyelashes. Some people also get fevers, headaches, nasal congestion, that is like flu-like symptoms. You have swellings behind your neck, that is all expected. We have seen so far up till yesterday, we have seen 80 patients. As I said, as Dr. has implied, these are the patients who actually present. So 80 patients from Coast General, this is just for the past 2 weeks. Portrees sub-county, we have seen 36, Likoni 33. We also have data from a private facility. I can share. They have shared their data. They have seen over 200 patients. So these are patients who actually present to the facility, the health facilities. Yeah. So as I said, there are some acceptable home remedies. These include, I would advise, cold compresses or warm compresses. What I mean is you just use cold water or towel soaked in cold water to soothe your eyes. You don't put it directly, you just put it on top of the eyes. Putting anything foreign in your eyes is very dangerous because we are all different, our immunities are different, so what might work for one person will not work for the other person. Anything foreign in your eyes, I have heard of honey, salt water, I have heard of tea, all these are not safe. Typically, adenovirus can go from 2 weeks to 4 weeks. But the symptoms start worsening between 3 to 5 days, and we should start seeing resolution, symptoms progressively going down.